Welcome back to the channel, everyone. It's your host here, and today we're diving into a sensitive but incredibly important topic, recognizing the subtle signs that an elderly loved one might be in their final year of life. Have you ever found yourself wondering if a loved one's recent changes are just part of aging or something more significant? It's a question many of us face as our parents, grandparents, or other elderly relatives get older. According to recent statistics, while the average lifespan is increasing, it's crucial to be aware of the subtle shifts that can indicate a decline in health, especially in the last year of life. Recognizing these signs isn't about predicting the future, but rather about being prepared, offering the best possible support, and making the most of the time we have left. Today, we're going to discuss 5 key signs that might indicate an elderly person is entering their final year. These aren't always obvious, and they can sometimes be mistaken for typical age-related changes. However, understanding these subtle warnings can empower you to provide better care, facilitate important conversations, and ensure your loved one's comfort and dignity in their final months. By the end of this podcast, you'll be equipped with the knowledge to identify these often overlooked signs, understand why these changes might be happening, know what steps you can take to provide support, and seek appropriate help. This isn't about fear, but about awareness and compassion. So, let's get started. Before we jump into the 5 signs, I'd love to hear from you. Have you ever experienced a situation where you noticed subtle changes in an elderly loved one's health? Share your experiences in the comments below. Your insights can be incredibly helpful to others going through similar situations. And of course, if you're new here, don't forget to subscribe and hit that notification bell so you don't miss out on future discussions about health and well-being. Sign 1. Significant and unexplained weight loss. Our first sign is significant and unexplained weight loss. We're not talking about a few pounds here and there, but rather a noticeable and persistent drop in weight that isn't due to intentional dieting. This can manifest as clothes becoming noticeably looser or a more frail appearance. This weight loss, often referred to as cachexia, can occur due to a variety of factors. As the body systems begin to slow down, appetite can decrease significantly. There might also be underlying medical conditions such as advanced cancer, organ failure like heart failure or kidney failure, or chronic infections that contribute to a loss of muscle mass and fat. The body may also have difficulty absorbing nutrients from food, even if the person is eating. I remember a friend telling me about his grandfather, who had always been a hearty eater. In the last few months of his life, he started refusing his favorite meals and gradually lost a significant amount of weight. At first, the family thought it was just a decrease in appetite due to age, but it turned out to be a sign of his body weakening overall. If you notice significant weight loss in an elderly loved one, it's crucial to monitor it closely. Keep track of their weight if possible. Offer small, frequent, and nutrient-dense meals. Ensure they have access to their favorite foods to encourage eating. Consider nutritional supplements if recommended by a doctor. Ignoring unexplained weight loss can lead to further weakening of the body, increased risk of infections, and a decline in overall quality of life. Addressing it early can help manage underlying conditions and ensure the person is getting adequate nutrition and comfort. You can gently ask if their clothes feel looser or if their belt needs to be tightened. Observe their eating habits and how much food they are consuming. If possible, discreetly weigh them regularly. Unexplained weight loss should always be discussed with a doctor. They can perform a thorough evaluation to identify the underlying cause and recommend appropriate interventions. This might involve blood tests, imaging studies, or referrals to specialists. Sign 2. Increasing fatigue and weakness. The second sign to watch out for is increasing fatigue and weakness. Feeling tired occasionally is normal, especially for older adults. However, a persistent and significant increase in fatigue, where the person feels constantly drained and weak, even after rest, can be a red flag. This profound fatigue can be a result of the body's declining energy reserves. It can be associated with organ dysfunction, anemia, low red blood cell count, chronic illnesses, or simply the body's natural slowing down as it approaches the end of life. Muscle weakness can also become more pronounced, making everyday tasks more challenging. My grandmother, who was usually very active, started experiencing overwhelming fatigue in her late 80s. She would tire easily after short walks and needed frequent naps. We initially attributed it to her age, but it was a gradual decline in her overall energy levels that signaled her body was weakening. Encourage rest and pacing of activities. Help them with tasks that are becoming difficult. Ensure they have a comfortable and supportive environment. Gentle exercises, if tolerated and approved by a doctor, might help maintain some muscle strength. Ignoring persistent fatigue can lead to social isolation, decreased independence, and a lower quality of life. Recognizing this sign allows you to provide the necessary support and adjust their daily routine to conserve energy. Observe their energy levels throughout the day. Are they needing more frequent or longer naps? Are they struggling with activities they used to do easily? Ask them how they are feeling and listen to their responses. If an elderly person experiences a significant increase in fatigue, it's important to consult a doctor to rule out any treatable underlying medical conditions. They can also offer advice on managing fatigue and improving comfort. Sign 3. Withdrawal from social activities and loss of interest. Our third sign is withdrawal from social activities and a noticeable loss of interest in things they once enjoyed. While it's natural for social circles to change with age, a sudden or significant decrease in engagement can be concerning. This withdrawal can be due to a combination of physical and emotional factors. Increasing fatigue and weakness can make it difficult to participate in social events. They might also be experiencing pain, discomfort, or a general feeling of unwellness that makes them want to isolate themselves. Emotionally, they might be processing the end of life and naturally start to withdraw. In some cases, depression can also play a role. I remember an uncle who was always the life of the party. In his final year, he gradually stopped attending family gatherings and lost interest in his favorite hobbies like gardening and playing cards. It was a clear sign that his zest for life was diminishing. Gently encourage them to participate in social activities if they feel up to it. Offer to spend quality time with them, engaging in calm and enjoyable activities. Respect their wishes if they decline, but continue to offer opportunities for connection. Create a supportive and loving environment. Social isolation can lead to loneliness, depression, and a decline in mental well-being. Recognizing this sign allows you to reach out, offer companionship, and help them maintain connections with loved ones. Observe their level of engagement in conversations and activities. Are they initiating interactions or mostly staying quiet? Are they expressing a lack of interest in things they used to enjoy? If the withdrawal is significant or accompanied by other signs of depression, such as persistent sadness or loss of appetite, it's important to seek professional help. A doctor or therapist can assess their mental health and recommend appropriate support. Sign 4. More frequent infections and slow healing. The fourth sign we're discussing is more frequent infections and a noticeable slowing down of the healing process. This indicates a weakening of the immune system. As the body ages, the immune system naturally becomes less effective at fighting off infections. This can lead to more frequent colds, flu, urinary tract infections (UTIs), or even pneumonia. Additionally, the body's ability to repair itself slows down, so minor cuts, bruises, or skin irritations might take longer to heal. My neighbor's elderly mother started getting frequent infections, one after another. She would recover from one cold only to catch another one shortly after. Even small scrapes seemed to take weeks to heal. This increased susceptibility to illness was a sign of her declining health. Ensure they are receiving proper nutrition and hydration. Encourage good hygiene practices, such as frequent hand washing. Make sure they are up to date on their vaccinations, such as the flu and pneumonia vaccines. Monitor any wounds or skin issues and ensure they are kept clean and dry. Frequent infections can lead to serious complications, especially in older adults. Recognizing this sign allows you to take preventive measures and seek prompt medical attention when infections occur. Keep track of how often they are getting sick. Notice if minor injuries are taking longer than usual to heal. Any signs of infection in an elderly person should be promptly evaluated by a doctor. Early treatment can prevent complications and improve their comfort. Sign 5. Increased need for assistance with daily activities. Our final sign is an increased need for assistance with daily activities. This refers to tasks that they were previously able to do independently, such as dressing, bathing, eating, using the toilet, or managing medications. This increased dependence can be due to a combination of physical and cognitive decline. Muscle weakness, decreased mobility, chronic pain, or cognitive impairment like dementia or Alzheimer's disease can make it difficult for them to perform these tasks safely and independently. My grandfather, who was always very independent, gradually needed more and more help with everyday tasks. First, it was just needing a little help getting dressed. Then he needed assistance with bathing, and eventually, he required help with eating. This progression indicated a significant decline in his functional abilities. Assess their needs and provide appropriate support. This might involve helping them with specific tasks, modifying their living environment to improve safety and accessibility, or considering professional home care assistance. Ignoring their increasing needs can compromise their safety, dignity, and quality of life. Recognizing this sign allows you to provide the necessary support and ensure they are living in a safe and comfortable environment. Observe their ability to perform daily tasks. Are they struggling with things they used to do easily? Are they expressing frustration or difficulty? If you notice a significant increase in their need for assistance, it's important to consult with their doctor or an occupational therapist. They can assess their functional abilities and recommend appropriate support and resources. So, there you have it. 5 subtle signs that might indicate an elderly person is in their final year. Significant and unexplained weight loss, increasing fatigue and weakness, withdrawal from social activities and loss of interest, more frequent infections and slow healing, and an increased need for assistance with daily activities. It's important to remember that experiencing one or even several of these signs doesn't definitively mean someone is in their final year. However, recognizing these changes can prompt important conversations with your loved one and their healthcare providers. It allows you to focus on their comfort, provide the necessary support, and make the most of the time you have together. This can be a challenging time, but it's also an opportunity to show love, compassion, and understanding. By being aware of these subtle warnings, you can ensure your loved one's final journey is as comfortable and dignified as possible. Remember, seeking professional medical advice is always crucial for accurate diagnosis and appropriate care. Now, I'd love to hear from you again. Did any of these signs resonate with your experiences? What other subtle changes have you noticed in elderly loved ones? Share your thoughts and insights in the comments below. Your experiences can be invaluable to others. If you found this information helpful, please consider sharing this podcast with anyone who might benefit from it. You never know who might need this information. Thank you so much for tuning in today. If you haven't already, please subscribe to our channel for more discussions on health, well-being, and navigating the challenges of aging. Hit that notification bell so you don't miss our future episodes. And as always, thank you for being a part of our community. Take care, and we'll see you in the next episode.